how the socialization impact on performance of masculinity and the health implications. So the first statement, which speaks to the dilemma, it says not everything that have balls is a man, because a ball bearing has plenty balls. Now that is a very profound statement, because what that is saying, and it's amazing, when we see a woman, we take it for granted she's female. But when it comes to a man, we think of men along a continuum. The other critical statement, and this was stated by someone from the trade union movement. He said, if you meet somebody and they tell you they don't drink, they don't smoke, they don't lie, they'll only be with their wife, you're not a real man. To be a real man, you have to do a certain amount of things that are detrimental to your health. If you're not doing that detrimental to your health, you're not a man. Now, this is extremely serious, because what this is saying is that in general, as men, health is not a priority. And it has been borne out in the literature. So it's important then for us to recognize as men, this old proverb is still true. You never miss the water till the well run dry. And I remember years ago, I was a student nurse then, and there was this millionaire who was leaving Trinidad to go to open a gas station in New York. And he was diagnosed with chronic renal failure. In those days, we didn't have hemodialysis. We only had peritoneal dialysis, which is actually washing out the abdomen. And I remember him saying to me, nurse, I will give up all my money just to have my health. And the sad thing for most of us, when our health is gone, in spite of all that we would have gained and stacked away, very often it is of no real value, because our life will really be an extended sentence of suffering. And that's why we really have to step back and consider what is our most valuable asset. Some of us, we work very hard, more than one jobs, because we want to provide. We want to build a big house. But then with everything else, with the changes of life, very often that room upstairs, you will no longer be able to climb the stairs if you don't manage your health now. So that we prioritize everything, but that health that God has given us, bearing in mind that 3 John 2 says, that, beloved, above all things, I wish that you do what? Prosper and be in, even as your soul prospereth. So, this is the statement. I just shared it with you, with this patient, and that has stayed with me from 1986 to now. Almost, 30 years. That statement has remained with me. And that's why as men we have to ask, who is responsible for our health? Who is responsible for our health? You're sure? You are. Good. And what does that responsibility constitute? I want a man's voice, yes. Right. So eat things that are healthy So you wouldn't be walking with waist pain and back pain and thing. All right. So after you eat, what you do? Apart from going to the toilet? Exercise. How many of us as men have an exercise routine? All right. Okay. So you realize all of us are eating, right? All right. So it's important for us, before I come to some of the issues, to recognize the role of socialization in how we deal with our health. And according to the International Council of Nurses, it says the socializing of men into masculine role impacts on their health, their beliefs, their attitudes, their perceptions, and their risk-taking behaviors. And we're going to come to that, some of the issues, in a while. But let's bear in mind what are some of the realities that we have to contend with. Whether we like it or not, for most of us, our wives will outlive us by at least 5 years. So we might as well as come to the reality that we may not be around. I'll say no more. But it's also important for us to recognize that we have higher mortality rates than women. But there are some of the cardiac problems, heart attacks and strokes. Women after menopause overtake us because they no longer have the estrogen to help to moderate or distribute the fat. So that women die from those illnesses faster than men. But it's also important for us to recognize we take greater risks. We also respond to stress and change differently because we have to maintain this stoic, macho image of being a man. But we don't go to the health services. We don't visit until it's very often way too late. And it's a sad reality for many of us. We always have this feeling, I could fight that, I could deal with that, I could. That's a little thing. And we fail to do due diligence in ensuring that we take care of our health. And we are also likely to have more frequent admissions than women. But I'm going to start with one of the commonest health issues affecting us, which is prostate cancer. Now, prostate cancer is one of the slowest growing cancers. The sad reality is, for most men, by the time they are diagnosed, it is late stage. So we would have had to be contending with messages from our bodies that we never took note of, or we chose to ignore. Even though testicular cancer affects the younger population, it's not very common, but I thought I'd put that in. But you see, it's also important that part of the challenge we face is how men view the physical examination, and we'll talk about that a little more. And the fear of the perception of others. And I remember one man saying, one day he said, well, you see me, I don't want nobody put their finger up there, because I don't know if I'd like the feeling. No, it's a serious issue. I would have never thought about it had he not said it. But many of us, we really don't want to subject ourselves to this But I want you to notice with this, as we grow older as men, and I didn't have the latest figures, our risk for prostate cancer increases by age. So I want us to bear that in mind, and we'll talk about some other risk factors. But I want you to notice that looking at the PAHO data from 2013, prostate cancer accounts for about 34% of all the cancers in male death. So it's important for us to see how prostate cancer is a serious issue for us as men to contend with. And some of the risk factors, when you look at the medical surgical literature, high consumption of red meats, the goat and the beef, and those meats, predisposes us to greater risk. And you know, some of us, we can't eat without the meat. I mean, some of us, it's because we were hungry, we bore with the lunch today. You understand? Let's be real as men, right? We have to be real. So that we are still challenged when it comes to our meat. But it's the type of meats that predisposes us to risk. Also, a reduction or little yellow vegetables, the pumpkin, carrots, you know, the fruits and so on. Limited amounts of these foods also increases your risk. And for some of us, and that's why you would find among the East Indian population, the urologists in Trinidad have identified a strong link between lycopene being protective against prostate cancer. Simply because what they say, you get lycopene, which is an enzyme that is released when it's exposed to heat. So you find among the East Indian community, they use a lot of tomato choker. It's very high in the tomatoes. So eating raw tomato salad will not have the same lycopene effect as the tomato choker. So man, eat some more choker. It works. Now, what the research is also showing now is that there is a strong link between the human papillomavirus, which leads to warts. It is well established that it's associated with cervical cancer, even though there are over 100 types of the HPV. There are only just a few that are associated with cancer. But what they have seen is that a lot of men who are now diagnosed with prostate cancer also have been diagnosed with the human papillomavirus. And it's a viral infection, sexually transmitted infection, that is usually transmitted from male to female. And your family history, if you have a family history of prostate cancer, it's very important that from the age 35, you start having yourself checked. Check for the first 3 years if everything is fine. You could give like a 2-year or 3-year break. But it's very important that with your family history, you get yourself checked. And I showed you from the data, as you grow older, you run an increased risk. Now, it's important to understand where the prostate gland is. And this is a better picture. This is your urinary bladder. Okay? So just under your urinary bladder is what we call your urethra. All right? This tube, which passes through the penis. But just at the base of the urinary bladder, surrounding your urethra, are you seeing this kind of circle? That's your prostate gland. And sometimes your prostate gland could be enlarged, what we call hypertrophy of the prostate, which may be associated with aging factors, or it may be associated with infection. That is all right if your prostate is enlarged from natural processes of aging. But what is critical is that the larger the prostate is the more pressure it is going to put on your urethra, which means that just at the base here, there is a set of nerve endings which we call the trigone. So that when your bladder is filled of about 100 mils of urine, you would get that sensation, that tingling sensation on the nerve endings to want to pass urine. With an enlarged prostate, you would have that tingling sensation, but the flow of urine will be reduced. So clearly, you wouldn't void as you will normally void. Okay, so you would find that after a while, you take the penis out, you aim, you fire past the urine, shake, put back, and by the time you put back, you feel a little extra afterflow. That is as a result of this enlargement of the prostate. Now, you would find that because of the enlargement, if in case you have prostate cancer, there would be an increased stimulation of your nerve endings, which will cause you to have a frequency in passing urine. So you may find yourself going to the toilet more often than you would. Now, you would also find that in diabetes, if you're, early signs of diagnosis with diabetes. But you would also find that at this time, with the enlargement, you can no longer, as we say, burst duct. Right? As men, your pressure, now it's coming out as oil. Okay? So there is a slowing of the stream. But you may find that you have to stand up in the toilet and whistle and hiss and because you have the stimulation. The nerve endings are being stimulated, but the stream is not starting. That's critical. And you will also, as I just explained, also have what we call the afterflow. But if you begin to have blood in the urine, that is an indication very often that you have moved from the primary site of the cancer, and the cancer would have started to spread. So it moved out of the epithelial tissue, which is the inner lining, to very often the muscle and the blood tissue. And for quite a few men, it is only when they start with the back pains, because there are two sites that cancer of the prostate spreads to very easily. The first two sites will be the scrotum, right, the testes, and the back. So for some men, it is only when they begin to have a lot of back pains, and they can't explain it, and they go to get themselves checked, it means that it has spread now to your sacrum coccyx area of your vertebrae. Now, the diagnostic evaluations is what we call the digital rectal examination. It is the best examination where the doctor will put his finger up your anus and let me just go back so that you would be able to appreciate this. Right. So when this is your anus here, okay? Is your anus? Okay? So when he puts his finger up your anus, he's going to be feeling for the prostate. Now, there are two things that doctor will feel for. Under normal circumstances, he's not supposed to feel anything. So he's going to be feeling to see if the prostate gland is smooth. If the prostate gland is smooth, he would say, okay, that's just hypertrophy, it's enlargement. But if that prostate gland is what we call rough or undulating, that will be an indication that there is some kind of pathology. So then he would move to the other phase where he said, we could do the blood test, which is the prostate-specific antigen test. The normal levels are 0 to 4. Now, what is important for us as men, if you say, I'm not doing the digital examination, I'm going to do the blood test, what you need to bear in mind is that every time you go for your test, you should know what your levels are. If every year your PSA level is rising, that's an indication that you need to start checking yourself because there is some kind of pathology that is taking place. If, for example, if you speak with Dr. Badranji, from urologist specialist at San Fernando, if you have a PSA level of 22 and above, they will tell you, they will consider that as fourth stage, and surgery very often is not a likely option. They may start you on like hormonal therapy and the cancer therapy. But then there is also the ultrasound of the prostate, and there is also the biopsy where doctor now will take like a needle, nick a little piece of the prostate and then send it to the histology lab. When that goes to the histology lab, there are two things they'll identify. One, the cells. Are the cells looking as though there are any changes? If there are changes, they'll say, okay, yes, the person has cancer. And then they will decide now to do some further exploration to determine if the person has cancer, what is the stage of the cancer. Am I making myself clear? Good, good. So, you see, while prostate cancer is the leading cause of death, the DRE, or the digital rectal examination, is a major deterrent for us in accessing the services because it's associated with homosexuality. And that's a serious issue. And for a lot of men, they don't want to go because they don't, there are some men who don't want to know what they're suffering with. In fact, there are a lot of them who believe, if I know it will kill me faster, so it's better I don't know. And these are just examples. This is how the doctor will be putting the finger. And men, let's face it, what goes in there is much smaller than what comes out, not so? It's a fact, but we fear. What we fear, okay? Okay, so he'll be doing the DRE, feeling for the prostate, and this is the prostate-specific antigen. And from my research, I didn't set out the study prostate, but I thought I'd share some of the quotes that, to my mind, really speak to the levels of homophobia. So this fisherman said, is a man putting a finger up your butt, That must be a shame, that embarrassment. That come like you lost your whole manhood day. Now, you see how serious this is. Look at this other quote. And this quote is taken from a police. It's something nerve-wracking for you as a man to know that you have to go and skin your bottom. And a man pushing his hand and he pushing. That it goes against, for me, everything about being. Nothing ain't supposed to go inside there. And I'll share last quote. And this one by a prison officer. He said, imagine you're watching a man and you're experiencing a man doing you that. That's thing to just get up and fight. Now, this sounds hilarious, eh? But it speaks to the psychological trauma that men undergo with even thinking of getting their prostate checked, not realizing you could save yourself a lot of problems in the future. So we're going to look at another issue, which to my mind is critical, which is coping with the midlife crisis or andropause. And I put coping with the midlife crisis or andropause because this is a period where your chronic diseases, your diabetes and your hypertension takes on increased significance, because you would recognize that diabetes, after a while, will destroy your nerve endings. So you end up with things like damage to the nerves on the feet, we call peripheral neuropathy. You end up with damage to your eyes, the nerves in the eyes, we call it retinopathy. You end up with damage to your kidneys, the nephrons in your kidneys, and we call it nephropathy. But you will also find that it will damage your erectile tissue in the penis. On the other hand, you have men who are hypertensives, and they have to be on antihypertensive drugs. For a lot of the antihypertensive drugs, one of the long-term side effects is impotence. So some men have to choose between taking the drug and live, or not taking the drug but die on duty. Now that is a very serious issue, especially in a culture where sexuality defines who a man is. So we are experiencing, and it's a global problem, and I remember speaking to one of my colleagues in San Fernando a few years ago, and he said, Dr. Ocho, we have about 70% of our patients have some level of erectile dysfunction. Now, women who are going through their menopause and they say, look, I had enough of that, I want to serve my God, yes. Which man could go and say, boy, this thing ain't working at all, you know? Even as saints, you fear to trust the brother. So this erectile function is a real issue, and we have to face the reality. At 50, we can no longer behave as 15. But in our minds, we want to feel we're still there. That is why sometimes one word just put stress on us. You finished? Now, that's a serious issue, you know. You know where it is, man, you're feeling like a gorgon. Yes. Or sometimes with the erectile dysfunction, you could stand up, but you can't hit the run. By the time you're ready, if you want to do anything, she got to help you pack it in. You become goods and services now. Yes. Now, serious issues, brethren, is men we could talk. Yes. You see, but these things have a significant impact on how we see ourselves. Because everybody calling us Mr. Everybody calling us elder, so-and-so, brother so-and-so. And she say, you're done dead. Why you stop breathing one time? you going to deal with that as a man? Serious issues we're dealing with. This is not joking matters. We're laughing, but it's a serious issue dealing with this thing of erectile dysfunction and the perception of yourself by others. And remember, as men, this is all part of our exterior as to how a man should be. So someday, as one lady, her husband was cursing her, carrying on. And she said, John, you could only say it, you can't do it. Yes. Serious issues, brethren, serious. And so you find that for a lot of men, they become involved in what we call a lot of socially deviant behaviors. This is the time of the incest. This is the time, even some of the brethren, they're introducing video into their bedrooms, X-rated movies. This is the time when they're not getting anything home. They're going outside to look for help. In fact, when you look at the data from the Central Statistical Office, after age 50 or 25 years of marriage, the rate of divorce increases in Trinidad and Tobago. It's a reality, because for a lot of couples, there was nothing left to look forward to in the relationship, because they were merely enduring rather than enjoying the relationships. And one of the challenges we face is that whereas the woman going through menopause could take, let's say, between just a few months to about 2 years, as men, our testosterone level, it declines much slowly, or much more slowly than women. So this is why there are challenges, and I usually, when I'm speaking to adults, we have to deal with some of the issues. So she's going through menopause, you have to churn her up like ice cream, right? Because her fluid is not, her juices are not flowing as readily. No more the days of quickie. Days of quickie pack aside. So now you have to churn up as ice cream. And by the time she come in, you are you. No serious issues, brethren. We're dealing this, and that's why I'm taking a socio-cultural approach, so that we can understand the dynamics. And I love this, which I got what every adult needs to know about impotence, because it says sex is a man's second strongest instinct, an instinct that is second only to the survival instinct. This means that if a man's life is not immediately imperiled, the next thing he will automatically think of is sex. I didn't say that. It's strong. So you can imagine the poor brothers who are not married. Pray for them, brethren. Pray for them. Pray for them, and pray for some of you who are married too. Yes. Okay, so, and the final issue that I'm going to deal with is coping with stressful situations or mental health issues. In fact, if you look at the literature, it's saying that suicide is the silent epidemic amongst men. I don't know if you listened to the news yesterday, but I think, was it the secretary of the steelworkers of one of these unions? 48 years committing suicide. Because you know why? As men, we are not socialized to talk. We talk stupidness, but not issues. We sit down and we bust a lime and we old plug and we make joke because we want to deal with the surface issues. And some of us, we know how to put on a front because we don't want anybody to enter our personal space. So we try to protect ourselves, and sometimes we drown ourselves with church work. You're always by the church working for Jesus. Especially if you're a first elder, because you have the opportunity to be in charge. You are the boss, you sit on the board and you chair the board and you shake everybody's hand and you ting. And when you go home, it's war. And you have nobody you could trust enough to talk. And what the literature also speaks to is the fact that depression in men is not easily diagnosed. Because we find socially acceptable ways to deal with our depression. We go online, go and do missionary work, because we don't want to spend time with ourselves dealing with our situation alone. And we have things like separation and divorce. I mean, some men, they don't understand why their wife behaving the way she is. You're in the same house, but you're in two different homes. How is a man to deal with that? Who can he trust to share his deep hurts and pains, where he has to cry sometimes when nobody sees him crying? So he has to go and spend a long time in the bathroom, bathing himself with water so that he could at least shout a little bit to God and cry and make sure that his eyes are not red when he comes out of his lonely place. Who is there talking to the man to help him deal with his social issues, the whole issue of death? I mean, what is there for us to help men whose spouses die? We come to the wake. But who is there for him to deal with his emotional trauma and stresses? Some of our men are being abused, but the women are always seen as the victims, where they tell you all manner of things, and they say, hit me knife, and the man hit me. And they challenge you to hit them. But people see the red eye, they see the bruises, but they never heard or were never present when you were going through your psychological trauma. And the church is so unkind that they know some of our sisters ask Jesus for excuse and curse us. It's true. You know what I'm talking about is true. Some of you have some good cuss out. And you don't worship for some days because you're vexed. Until you find it in your heart to forgive each other and all you pray out. Or you're even discussing that issue of the cuss out. Or you just start back as though nothing happened. Violence. And of course, the suicide, which is the silent epidemic. And it was interesting how some of the men looked at this. And I think I took two quotes. One sportsman, and I really loved this. He said, like, if I want to do you something, Once I can't get to do what I want, I can't get to deal with how I feel, I should deal with or just cry. If I don't do that, I know I'm going mad. So how are you going to ventilate in a way that you would not be seen as not being a Christian? And a lot of the issues we have to contend with as it relates to addressing our psychosocial mental health problems is the fact that we are expected to be stoic. How do we trust others when we're not sure if it might come up as an example in a sermon? How do we as men make ourselves vulnerable when we have to be stoic, and if you seek help, that is seen as questioning your ability to be a man? So we say, what kind of man you gonna make, boy? And there's a difference between the cultural expectations and our real life experiences. Nobody knows the hurt that some of the brothers go through, because many of them will not believe it. Because the wife always in the front seat with the wedding band hanging out and giving right to everybody. And she wants to have nothing to do with you. And the adoption of socially acceptable destructive behaviors. And I'm sort of coming down to the end. And that's why we have to ask ourselves, what kind of approach are we going to take to help our men? Are we going to continue with a medical model where we provide you with a set of facts and pieces of information? If you do this, this is going to happen. If you don't do this, that will not happen. Or are we going to now look at a more psychosocial approach where we would focus on helping to reach men at the affective domain rather than the cognitive? Where we could sit down and not just laugh, but for the last few minutes you went so silent because I realized you were thinking about how this is affecting my attitude and how could my behavior change. And we really have to flip from the medical to the psychosocial. So I want you to ponder in my last two slides. Health, when it is gone, could absorb all your assets. So preserve it. Because don't wait for the doctor to fix it. Yes, that's what we call a penile pump that you could get inserted. So when you're ready, you pump it up. And when you're done, you let the air down. Yes, question? Do we have a roving mic? Do we have a roving mic? I'll take it.
Yes, doctor. It seems to me that every time I hear about prostate cancer, and the exam is always associated with male doctors. Are there female doctors that do this exam?
Yes, there are female. There are female doctors that do the exam, but I don't know of any female urologists. And the reality is that is part of the conflict, because men want more men in the health services, but when it comes to the prostate exam, they want a woman. You know why? Some of them have said to us, well, if I have an erection, I would much prefer to have it with a woman. So if I have an erection with a man, he might look at me funny. Now, it's amazing how we take something that is beneficial to us into a sexualized connotation and forget this is a professional relationship.
Yes, often concerning the prostate. Just yesterday I was doing a little research on the prostate, but while I got some information which I am very pleased of. The question is, often most men at the age of 50 going up, sometimes they do not feel to urinate when it's supposed to. But when they open the tap, they usually feel to, and they hurry down to the, does that a sign of the prostate problem?
That might be a sign of prostate enlargement, not necessarily prostate cancer. Here.
My concern is about nutrition.
Yes.
A lot of, pretty much everything you say, research, all right? But in the Adventist domain, do we have any research on nutrition and the kinds of help that it will afford men? Do we have anything like that, especially in light of the modern day food trend with GMOs, and they tell me soy. Some of the things we get for food are detrimental to men's health. Do we have any research on nutrition?
Well, in fact, there is a more than 50-year study, Adventist lifestyle study that is done by Loma Linda University. And what that has shown is that Adventists live, I think it's an average of 10 years longer. But what they have also recognized is that it's not that the Seventh-day Adventists would not be diagnosed with some of the other problems. But if they are diagnosed later than the average individual. So to be more direct, that's the only real study I could speak to where lifestyle as it relates to nutrition and exercise and so on are factored in and after the analysis, it is shown to be protective for the Adventists, both men and women. Walter.
I would like to say this evening that as men here, most of our mass has been removed because we are suffering from the same thing as other men.
Yes.
So I think we are in a position to assist, to be sympathetic with each other, because this is something that faces each one of us. So we don't have to look at the corner and say, well, I wonder if that brother is going through this situation. Be that as it may, the prostrate, what is the purpose of it? Do we need it in our bodies? And why do they not take it out before or during problems?
All right. Very good question. The prostate gland has two important functions. One, it is to increase the fluid in your ejaculate. So 75% of the fluid in your semen comes from the prostate. But the prostate also helps with the maturation of your semen, of the cells, your male sex cell. So it has an important function. Can we live without it? Yes, we can. Would it affect our sex life? No, only if during the removal of the prostate, let's say they're doing what we call the transurethral resection of the prostate, big word. What that means is technically, doctor will go through the penis with a kind of a microscope with, to the end of it, would have a machine that will burn, but while it's burning, it's also stopping the blood vessels from remaining exposed after the burning. And so what that does is that in the process of doing that, you could also have your nerve ending or your nerves damaged. If your nerve is damaged, then you go into impotence. And you will now have to go and get a pump. So I'm just trying to tell you there's hope. Yes, yes.
Anthony Clark is the name, Point Fortin Church, men's ministry leader. I'm a person conscious about health, and I want to ask about preventative measures in terms of fruits. All right, my research and from information sources, is it true that pawpaw skin has properties to fight against malignant cells, which causes cancer, whether it's the prostate or not? And rough skin lemon is one of the fruit that has high properties to fight against malignant cells. I have recommended rough skin lemon for 2 cancer patients at my job who was going through chemotherapy. It is said that rough skin lemon, the whole fruit, not just the juice, is 10 times stronger than chemotherapy. And you can bear me out on this if chemotherapy damages the good and the bad cells.
Yes, you know that.
And leave you with a lot of side effects. An individual on work who, after taking chemo, was very distraught mentally and physically. And after using the rough skin lemon for some period of time, she began to rejuvenate and her size came back, her hair grew longer, she didn't have to wear a wig again. And recently we had a manager who had a breast amputation, and she's now doing the same process with the rough skin lemon. There's a whole lot of medical function, one especially fighting against malignant cells. So in your research, I would believe that you have researched foods that would help us to fight against malignant cells that causes cancer.
No, well, let me start off by saying your assumption is not right. I have not studied food.
Okay.
My first master's is in public health. My second master's is in philosophy, sociology of health, and my doctorate is in public health and policy. So I have not studied foods, so I can't speak to foods. As to whether the skin of the pawpaw has cancer-fighting properties, I can't speak to that. But as I indicated, that will fall under the group of yellow vegetables, which has been identified as protective for men against prostate cancer. So yes, eating pawpaw will help to reduce your risk of being diagnosed. There is a lot of work that has been done on the value of rough skin lemons. It has been identified as very beneficial to health, but as to its impact on reducing your risk of cancer or treating cancer, or whether it's 10 times better than chemotherapy, I have not read any study to substantiate that. But your fundamental question on whether chemotherapy affects both healthy and unhealthy cells, the answer is yes. In fact, every single drug from Panadol up, even the long-term side effect or complication of Panadol is liver failure. Every drug, the drug that might be good for the eye may affect the heart. The one good to help with circulation may affect the eyes. So every drug has its own side effect. But one of the things, that's why they do research at different levels, and what they are more concerned with, would the benefit outweigh the risks? And based on their statistical computations, and they realize you can add X number of years to life so that the quality of life may be improved, then you can cope with the side effect because you're getting an additional benefit.
Thank you very much.
Yeah.
With the rough skin lemon, research have been done, and I have information on it. All right, at work they always send us health tips. All right, from TIFA on a monthly basis. All right, so I have a whole list of benefits of rough skin lemon. All right, so if you can see me after, give me your email address. I'll email it to you for free.
Yes.
So you can have that particular information because research has been done on it.
Good, good. Who's doing the research?
I can't say exactly right now.
Right.
but I have
You see, because there's something we call the ethics of research. Because sometimes, depending on who is funding the research, you can manipulate the results. But I know there is work done which shows the value of rough skin lemons. We have one hand here and one to the back. Yes.
Lashma Brown, San Juan SDA, nursing assistant, scrub tech, worked in the theater, cut off plenty breasts, plenty testicles, and penis. So I'm happy that we as men are having these things. But my concern is generally, the church focuses on the traditional type medicine. I would like if we could help ourselves to have that second opinion in terms of having a listing of naturopathic doctors, because there are several of them, I understand, in Trinidad or available to us. So the issue of what we had as medical missionary training and teaching, I'm not sure that that is being offered to us fully yet, and I'm thinking we are disadvantaging ourselves in not having that information available to us, which we have in many of our conferences outside. So I'm hoping that we could start looking towards that direction. If, for example, it were possible in Trinidad, that's where I would want to go. But you'd have to go Jamaica, you have to go Canada, you have to go to the US and other places. So I'm wondering if our church can be instrumental in helping to focus along these lines, because Spirit of Prophecy tells us our first study for children, the first thing they should learn about is their bodies. So I'm seeing an opportunity for us to be able to change, as you're saying, how we think in terms of results, and not just the information, but the actual effectiveness, which is what naturopathic doctors try to do to help you work with your lifestyle and lifestyle coaching and such like.
I totally agree with you. There's a place for the naturopathic. My concern, though, is that very often there are so many people who are just setting up shop and they're misinforming people rather than informing people. And therefore it's difficult sometimes to strike the balance. You know, but there is a place for naturopathy. Yes, yes, yes. Yeah, definitely. Yes, yes, sir.
Yes, good evening. Concerning cancer. Now, my wife was diagnosed with cervical cancer. As the gentleman was talking about lemon and thing. Let me give you a real cure for cancer. Now, this is serious business. This is no laughing business. My wife had cervical cancer, tested 3 times positive. Now, soursop is 10,000 times stronger than chemotherapy. Not only by using soursop. Right now, they can't find no cancer in my wife's body. No dairy products. No dairy product whatsoever. You stop it. No cooked food whatsoever. You stop it. Your whole wheat and whatever your little steam food and thing for a while. That means that you wouldn't go back and eat it, because right now she eats back original. It comes like a plant inside your house. If you don't feed it water, it will die. What I know through my wife, through this long stay, we went in all these cancer places for counsel and thing. Cancer feeds on what you eat. It don't feed on your body. Your bone, your flesh, neither your bone, whatever it is, your blood, it don't feed on that. It feeds on whatever you eat. So if you stop what cancer feeding on, it will kill it. Right now, she's free from cancer. They say it have no cure. It have a prostate, you know. The plus is accepting Jesus Christ in your life seriously. Because that is the man who make your body. And if he make your body and you ask him to refreshing the parts that are effective, he will do it. So that is how we went about with this thing. Serious prayer, eat what you're supposed to eat, drink what you're supposed to drink. That will help you. Anybody with cancer. We went through it in our life. We had a hell of a lot to run around. And that's the cure for cancer. I will ask the doctor to recommend me something. Right now, I'm a taxi driver, 19 years, my 2 foot numb. Pressure on my foot. That's the problem I'm going through right now. So I don't know what I could do about it, but
So maybe what you may be having is what we call a circulation problem. Sometimes it's called intermittent claudication. So some of you get the kind of cramping.
yeah, I get cramping like Junjuni.
Right, the junjini. So the junjini could be two things. The cramping as a result of circulation. Are you a diabetic?
No.
No, okay. So that sometimes if there is any damage to the nerve, you can also get that junjini. So it might be good to see a medical doctor, who your doctor is, to have a proper examination. That will be able to help you with that. But again, there is work to show that soursop has been protective, but again, I don't know if it's 10,000 times better.
Well, okay.
But thank you for sharing. I think we have last two, or last three. So I'll take the questions one after the other, and then I'll answer in one. So I don't want you to make a comment, just ask the question.
Dr. Brother, we are often told about women having menopause, right? That's when men start to go bald. Number one, they say it's a pause, but it seems to be a full stop. You can speak to that. And we hear about men having andropause. We hear very little about that. Could you speak to that, please? Thank you.
Okay, yeah. Well, rather than a pause, a full stop. Stress.
All right. You spoke about the being examined early. All right. If you are examined early and it is detected, what now? And also, somebody told me about bachelor buttons. Can you elaborate?
No,
on
I
that?
can't speak about bachelor buttons. I'm sorry. I'm not into naturopathy. Yes, but I'll speak to that.
Here we are told concerning sickness and disease, we should reason from cause to effect. So what I wanted to know is what really causes prostate problems, whether it's too much sex or no sex at all, or eating wrongly, or what causes?
All right. So let me answer the last question first. No, the only association between sex and prostate is the human papillomavirus. So it is associated now with a sexually transmitted disease. If you have a family history, and for all of us, we have cancer cells and cancer thrives. What cancer is, basically, is an abnormal growth of your normal cells. So your cells are supposed to live and die after a certain time. With a cancer cell, it doesn't die. That technically is what cancer is. Concerning if you're diagnosed with prostate cancer, the staging of the cancer will determine the treatment. If you have stage 1, sometimes doctor may just order some intensive, refer you to the radiologist or the oncologist, and they may do some radiotherapy or the resection of the prostate, stages 1, 2, 3. If you are diagnosed at stage 4 or stage 5, usually the first thing they will do is decide to do what we call orchiectomy, or removal of your testes. Removal of your testes will cause immediate impotence. But they will remove the testes because the androgens will continue to exacerbate the spread of the cancer. And with the removal of the testes, they will also start you on female hormonal therapy. The female hormonal therapy will help to counteract any further spread of the prostate cancer. So that relates to that. The first question, yes, menopause. Yes, there is something we call andropause, where the symptoms are almost similar to the menopause. Men will go through andropause, or what we call the midlife crisis, things where the balding of the hair. For some men, they start having increased abdominal girth, what we call abdominal obesity. Some men become crotchety. Some men, they start having little memory loss and so on. Some men, they have two things: increase in libido, but may not be able to sustain the increase because you don't want to die up here. You're dying down, so you want to live. And that sometimes puts pressure on the relationship because she now, because she's going through menopause, she feels she had enough of that. She wants to serve her God. Some men, because they want to still feel powerful, they want the wife to do all kind of acrobatic things, including eating furry burgers and sucking lollipops. And she says, my mouth is to serve God. So that it is the pressure that is placed on the relationships, because to a man, being sexual maintains a sense of masculine identity. That machismo image. For her, she had enough, she could talk to her friends, she could go away. So that's why negotiation is extremely important at this time. Now, I wish I could take your hand, but I think that we have come to the end. Man, it was really, talk to me after. I will come straight to you.